Utah Business is proud to present the 2022 Healthcare Heroes, recognizing excellence, innovation, and achievement for healthcare in Utah. Today's event is sponsored by Roseman University of Health Sciences, Digital Bytes Production and Design, Intermountain Healthcare, Web, ABS Kids, Advanced Healthcare, ARUP Laboratories, CHG Healthcare, Eye Care for Kids, Nightingale College, Optum Healthcare, and Savage. And now please welcome your Master of Ceremonies, Weekend Anchor with KSL News, Debbie Worthen.
We're going to get this. Okay, here we go. Good afternoon, everyone. Thank you so much for coming. You all look fantastic. I hope you're ready for a great lunch and an incredible program. On behalf of Utah Business and Roseman University of Health Sciences, I am pleased to welcome you to this special event where we spotlight and honor the healthcare heroes in our community. Those working in healthcare serve in a variety of roles: administrator, physician, educator, nurse, innovator. But they all share a dedication to healing and a commitment to improving the quality of life of their patients. From newborns to accident-prone teenagers, and from adults working to improve their health to those facing serious healthcare issues, healthcare heroes touch all of us. Each of the heroes we're celebrating today have shown a special passion for healthcare, and we appreciate all you have done. So congratulations to all of you for doing what you do, working long hours, saving and improving lives, and putting others' needs ahead of your own. Your work is invaluable, and we thank you for it. A little bit about Utah Business. Utah Business provides award-winning, in-depth journalism on the tech and entrepreneurial businesses at the forefront of our nation's economy. Their print and digital publication reaches executives across the state and provides live, deep-dive events on the industries shaping our future. Please welcome the publisher of Utah Business, Donnie Welch.
Good afternoon. Welcome and thank you all for joining us today to honor this year's Healthcare Heroes. We can't wait to share their stories with you, but before we do, I want to thank Debbie Worthen from KSL News for being here today. We appreciate your time. I also would like to thank Roseman University of Health Sciences, our presenting sponsor for today's luncheon, as well as our premier sponsors, Digital Bytes Production and Design, Intermountain Healthcare, and Web, along with all the primary sponsors, all of whom contributed greatly to today's event. It's no surprise that the healthcare industry is changing, and with good reason. That's why we're excited to honor these professionals dedicated to innovation in their fields. During the next hour or so, you will hear some amazing stories about our honorees, like Joseph Carbone, founder and president of Eye Care for Kids. He opened the first Eye Care for Kids 20 years ago when he realized that many children went without proper eye care due to uninsured, underinsured, or the economic burden placed on struggling families. Since that time, over 400,000 individuals have been served with vision screenings, eye exams, and eyeglasses. Or Maren Jacobson, who is the regional director for ABS Kids. Maren is a board-certified behavior analyst who has served patients with autism and their families for over a decade. Maren has been instrumental in increasing access to applied behavior analysis across the state of Utah, assisting in the opening of 5 therapy centers and extending home-based treatment into remote regions. Maren has worked hard each day to make sure autistic children and their families are not overlooked in our communities. These are just a couple examples of this year's honorees. Thank you all for being here with us today. And without further ado, let's hear more about each of these exemplary individuals. Thank you.
Roseman University is a fully accredited, private, nonprofit university with campuses in Utah and Nevada. Founded in 1999, the university offers accelerated programs to meet the healthcare needs of the communities it serves, including a Doctor of Dental Medicine, PharmD, 4 nursing programs, and 2 master's programs. The university provides a teaching and learning environment that prepares students to be competent, caring, ethical healthcare professionals. Roseman has graduated over 2,717 students. Does that mean it's 2,718? More than. So a lot. Over 2,700 in its Utah campuses alone, contributing to the local healthcare workforce, patient care, and discovery. Please welcome from Roseman University of Health Sciences, South Jordan Campus Chancellor Jeremy Wells.
Thank you very much. Roseman University is thrilled and really quite honored to be associated with Utah Business and this incredible event where we honor and recognize our healthcare heroes. We have been a sponsor of this event for 6 years. It's a highlight for us, and we look forward to it every year. You just heard a little bit about Roseman University. I'm very proud to be associated with Roseman University as well. I believe we're an absolute gem. Just a few things about it. You just heard a little bit, but I also wanted to talk about our commitment to giving back to our community. It's very important to us. One of the ways we do this is by providing free and reduced cost dental care to our underinsured and non-insured community members. In the past 5 years, we've seen 200,000 patients and have given out $5 million of uncompensated dental care. In addition, and this was really exciting for us, we just recently saw 150 of our newly arrived refugees here in the state of Utah and gave them comprehensive free dental care. In addition to that, twice a year we give free dental care screenings and cleanings to our youth and our children along the Wasatch Front. So we're excited about what we do with the community. It's very important to us. We also care deeply about our students and are concerned about the rising tuition costs in healthcare education. To help fight this trend, we offer a pharmacy degree in 3 years. It's usually 4, and so we chop off a year. In addition to that, this coming year, our dental school will offer a degree in 3 years instead of the traditional 4. That will make us the second institution in the nation to do that. And in so doing, we'll chop off 25% of the total tuition debt of our students. We care deeply about our students. We love them and want to serve them. On Monday, we were privileged to host a VIP reception for our healthcare hero honorees. I have met many of them. They are impressive and inspiring. They work so hard to serve us on the front lines of healthcare. We collectively want our healthcare heroes, our honorees, to know that we see you, we recognize you, and appreciate you. And now we're excited to honor you. Again, thank you for being here. Enjoy the lunch, and again, congratulations to all of our honorees.
And now we are pleased to move to the awards part of today's program. We would first like to recognize the honorees in the community outreach category. Please turn your attention to the video screens to learn more about these individuals that devote their time and efforts to worthy causes that help provide and improve healthcare services to the community.
I went to school in psychology thinking I was going to work with the youth, underprivileged youth. I had a fear of hospitals actually at that time, and I always tiptoed around them. I always avoided hospitals as much as I could. I started working with disabled individuals. And from there, I started working more in the medical field. I never saw myself stepping foot working with the geriatric group or in healthcare, but here I am and I love it now. If you hear the need in their voice and the relief that you hear in their voice, you get this sense of accomplishment and it just makes you feel really good at that time. I feel that I'm only a piece of a puzzle, and it's such a breath of fresh air for these patients. To be part of that piece, and I call it such a complex puzzle, to help those patients get to where they're at, it just makes my position and where I'm at so worth it in the end.
Please welcome Laura Bell, social worker with Optum Healthcare.
Hi there. I wasn't expecting to be the first person up here, so no pressure, right? So I actually decided to come a little bit more prepared for this little tiny speech than I did initially, so I do apologize for that. I first wanted to talk about F. Scott Fitzgerald. He once said, "Show me a hero and I'll write you a tragedy." So when I was a child, I was taught to never give up and to get back up on that horse. Is that ever easy? No, it was scary and unpredictable. Was it worth it? Every time. This has led me to achieve sweet success as a social worker and as a social worker for Optum Healthcare right now. I would never have thought that my professional path would lead me here, but here I am. And I'm loving the healthcare realm. I can't see myself anywhere else. And just so you know, my fear of hospitals is gone. I don't have a fear of them. They're there and there's amazing, and the work that is done there is so important. And so I work within the hospital systems, the post-acute systems, and out in the community too. So I just want to thank everyone who has been on this path with me and never gave up on me. And I'm so grateful for this recognition. I've never been in search for it, but I really am thankful, and I'm really, really thankful to be included with so many amazing healthcare heroes today. I want to send thanks, of course, to Optum, my supervisors, my managers, and to my husband, David Bell. Thank you.
I have had many moments in my career that have been rewarding, but helping the community, connecting to people with real life situations out there that share their stories of coming to this country like I did 20 years ago, trying to figure out the entire system, finances, education, healthcare, all the many differences between what many of us were used to overseas to the way things are done in the United States, and now having the opportunity to help others live the American dream and understand the system is the most rewarding part of my career. I am passionate about what I do. I enjoy being part of the healthcare industry. I've been part of this industry for now 17 years. There are new ways to engage with the community and consumers, and there's new ways to also contain cost and see what else we can do to help people understand their healthcare options. Now a lot of us are engaging with virtual care, telehealth, so we can see a doctor using our phone. So who knows in 5, 10, 15 years what healthcare will look like. So we can both connect people to the care they need, but also help them receive the care they need at the most affordable cost.
Please welcome to the stage from Select Health Intermountain Healthcare, their multicultural community relations partner, Sebastian de Freitas.
Thank you so much. Muchas gracias. It is an honor to be here today. The day that I received the email letting me know that I have been chosen as a Utah healthcare hero, my partner and I were getting ready to travel overseas on vacation. So I was out of the country when the photo shoot and the interviews happened. That's why it was recorded. But Utah business was flexible enough to let me record it remotely. So thank you for that. Healthcare can be complex, confusing, expensive, and scary. Developing trust and empowering our communities to own their healthcare journey is critical for both their experience navigating it, but also for their healing process and to stay healthy long term. So there is an opportunity to remove that fear, that confusion from the patient and member experience. I was born and raised in Uruguay. It's a teeny country in Latin America next to Argentina, for those who are going to Google it, in a totally different system where there's a limited choice, lots of pre-authorizations, medical panel meetings to determine if the care people need is truly needed. So when I moved to Utah, to the United States 20 years ago, and I was presented with so much choice, PPO plans, care advocates, networks of doctors that you could choose from. It was a lot to digest for people like me who emigrated to the United States. So I made helping people make smart choices about their healthcare my career. 17 years ago, I started helping those vulnerable and challenged by language, by culture, by income, my passion. I want to thank Utah Business for this recognition, congratulate the other honorees. I'm truly honored to be among you. I want to thank Edward Bennett and the Suazo Business Center for their trust. I want to thank my employer, Select Health, and my Intermountain Healthcare family for letting me do what I love, and also my partner, who is here with me of 19 years together, Mauro, for your support along my journey. Thank you. Gracias a todos.
Let's learn a little more about the companies that demonstrate their dedication to keeping employees and patients happy and healthy. Please turn your attention to the video screens and have a look at our honorees in the Corporate Initiatives category.
Originally, I started out seeking a degree in education, and then I found applied behavior analysis, which led me into more of a healthcare field, and I love it just as much as I loved working with kids in an education setting. I love helping people, and service has always been something that I've been super interested in. In my particular job, I get to help kids and their families, and that just brings me a lot of joy, and I'm just super happy that I get to work in a field that helps people. A day-to-day for me at ABS Kids involves supporting a team of providers that are providing therapy services to our patients, all of whom are either kids or teenagers. And I do that through providing administrative support, providing support for concerns that may be more challenging to resolve. And I also just do that through providing resources and finding ways that we can access needed information, resources, training supports, anything that can make the providers' lives easier and the patients' care better.
Please welcome Mara Jacobson, Utah Regional Director with ABS Kids.
Good afternoon. I just want to start by giving some thank yous to some very deserving people, some of which are here today in the room. I'd like to thank the entire team at ABS Kids. I'd also like to specifically thank the leaders that I get to work with who lead our teams and ensure that we have the best quality care that we can provide to the children and the families that we serve. Natalie Roth, Nicole Murphy, Amanda Taylor, Maribel Sweet, and Melanie Page. You all are heroes, and I really appreciate everything that you do for the families that we serve and the providers that we support. I'd also like to thank my family and my husband, who's here today, for all the support that he's provided me. There's just no way that I could be where I am today in my career and supporting my patients if I didn't have his support. And my sister, who's here as well, and I get to work with her. She's one of our behavior analysts at ABS Kids too, so it's really fun to see that service runs in our family. When I started out in the field of applied behavior analysis, I was working with children at the individual level and supporting them and their families. And what I saw through providing ABA to autistic children was that the impact was so great on their quality of life and on the experience that they were able to have through developing skills that help them to be more included in their communities. As a regional director at ABS Kids, I get to experience that same impact on a broadened scale as we improve access to care and as we grow in our ABA centers. I see that we're able to reach so many more individuals and empower so many more families to help their children and succeed in the best possible ways and to reach their maximum potential. And for that, I'm super grateful to be a part of that. I'm really grateful for this award and for Utah Business Magazine for creating such an awesome acknowledgement for all of the honorees who are very deserving of this sort of recognition and the work that we're all doing in the healthcare field. Thank you very much.
Our company motto at Savage is find a better way, do the right thing, and make a difference. And I feel like our benefits team at Savage is always striving to make a difference in our team members' lives. So recently, our biggest challenge was observing that our team members were really dealing with external and internal stressors. I feel like associated with the pandemic and isolation associated with that, and maybe financial stress and some civil unrest, just compounding mental health issues and struggles. Our team looked at what we could do to help our team members and what resources could we provide? Do we need to provide additional resources? How do we get that word out to our team members? And also, how do we make those resources available and really easy to access? I think what inspires our team is just the day-to-day challenges that we face, meeting the team members' needs. We always want to do the right thing and be there for the team member and provide the resources that we can that help them in their day-to-day lives.
Please welcome Leanne Sanford, Benefit Analyst with Savage.
Thank you. So although mental health challenges have always existed, I think like many of you, we saw how COVID had impacted our overall health of our team members. This year, our team decided to shine a light on mental health, working to get rid of the stigma associated with mental health, and then making that access to care for our team members and their families easier. With all the work we did, it's really tough to know whether we made a difference. We appreciate this award because it gives us some hope that, at least according to those with an outside perspective, that they can see that we did do some good things, and we hope that this message is reaching our team members. The nice thing about winning the corporate award
is it's clear that it's a team effort. I'm so grateful to work at an organization that is willing to invest in their people and puts people first. And I'm grateful for an insurance carrier partner like Regents who continues to innovate and find ways to make access to mental health care easier for our members. And I'm so grateful for an amazing team that I work with. They come to work each day with a desire to do their best. They come with innovative ideas and help me implement them. We often say we have the best team in the world, and truer words couldn't be spoken. And again, thank you for this award. Thank you to Utah Business Magazine and to all the other healthcare heroes. We will use this award as a motivation to stay energized and uncover better solutions to help our team members to live their best lives. Thank you.
Let's give our corporate initiative honorees another round of applause. We are so pleased to recognize our next two honorees in the category Healthcare Practitioner. Please turn your attention to the video screens to learn more.
Originally, to be completely honest, I went into healthcare because I wanted to know that I could take care of myself. But over the years, what I've realized is that healthcare is my passion. And after 14 years as working as a hospital medicine physician, I realized what I really wanted to do is help prevent people from having to go into the hospital. And so now I devote my work to taking care of undocumented residents who otherwise have no safety net for healthcare. I work with the most inspiring patients. I mean, truly incredible individuals who teach me on a daily basis what it means to be strong, to be resilient. My patients have walked here from as far as Venezuela, and they come to me for healthcare. So to be able to have the privilege of taking care of them, to offer them the human right of healthcare is something that is never going to get old. If you have the skill set and the means to be able to provide healthcare to people who need it the very most, you should. And so I have that capacity, and to be able to practice medicine in a way that is most genuine is profoundly meaningful.
Congratulations and welcome to the stage, Dr. Mari Leining, CEO of the People's Health Clinic.
Thank you so much for this honor today. It's wonderful to learn about all of these rock stars in Utah. Thank you to my family, who has been amazingly supportive of me working 7 days a week, which is what my heart tells me I need to do to be able to take care of my patients. When I tell people I run a free clinic in Park City, the response I get is, well, why would Park City need a free clinic, right? And people don't recognize the profound wealth gap in Park City, that Park City is run by a group of primarily undocumented residents who, because of their legal status, do not have access to health care. Even though 98% of my patients live below the 200% federal poverty level, they are not eligible for Medicaid or for the Affordable Care Act. And so really what my mission is to make sure that people who need health care the very, very most get it, and to make sure that people are aware of this population who shouldn't be invisible. Thank you.
I think the thing that inspired me to go into healthcare was having a dad who was a physiological chemist. He taught at Ohio State University, and I spent time in his lab, and he taught medical and dental students. And so that's what first piqued my interest. And then spending some time in Guatemala and seeing the needs that were there also sparked an interest in me to pursue a career in medicine. I think the most rewarding thing about my job is the people. It's the people that I work with in the office, it's the people that I take care of. It's developing long-term relationships, which is why I love family medicine, because there are long-term relationships. And being able to help someone, see them smile, being able to help them through hard times, I can't imagine anything more rewarding than doing what I'm doing now. I think one of the things that is the most unexpected thing that I've learned from working in healthcare is just how good people really are, how much they want to be good and to do good, how they're able to bear up under sometimes very difficult situations when they're suffering, and how they're always willing to be kind in spite of their suffering. Patients are wonderful people.
Please welcome Dr. Stephen Richardson, family medicine physician at Optum Care, Utah.
Oh, that's nice. The lights are so bright I can't see any of you out there. That's awesome. I teared up watching myself. Is that sad or what? I would be remiss if I didn't thank a few people. First, my sweet and wonderful wife, who has put up for over 40 years with my long and oftentimes erratic hours as a family physician. And the other group is a large group of people. It's the people at Optum Care. I've had a varied practice experience through my life, working with the Air Force as a military physician and as a private practitioner, and now finally probably doing what an old mentor told me in medical school, practicing as a geriatrician. So at the Optum Primary Care Clinic, we strictly see Medicare patients, and I'm having the time of my life. I think that working with the people at Optum Health who are all about innovation, all about caring, all about quality-based care, truly they're at the forefront and pushing medicine forward to where it really needs to be, where what counts is how well we take care of our patients. Seniors are an expanding demographic. It won't be too long before I help expand that number myself. And so it's good for me to be able to be with them and take care of them, not only providing for their health needs, but helping them kind of navigate the complexities of Medicare, which is wonderful, but it's difficult for them to understand what kind of things they need to do. And Optum Care actually provides me those kinds of resources where we can accomplish so much right in the office, real time. And we have a bevy of people that are there, like Laura Bell, who can help with the social services and other folks that can help them manage that. I think it's a growing demographic. It's wonderful to be in a place which is tailored to care for the senior patient. And I'm honored and somewhat humbled to be here today with you and appreciate those people that I've met along the way. Thank you.
Thank you, doctors, for all you do. Please join me in giving them another round of applause. Now that we have seen the doctors, let's take a look at our healthcare nurse we are recognizing this year. Please turn your attention to the video screens.
What inspired me to get into healthcare was I've always wanted to be a nurse since I was a little girl. I watched my father in the hospital quite often growing up, and I just was amazed by the nurses. I knew that they saved his life on multiple occasions, and that's what I wanted to do. The most rewarding thing about nursing is that it's challenging, but being there for people on their worst day or their worst moment or their worst time in life is very rewarding. To be there and to comfort them, to get them through it, to help them live. I can't think of anything better. My advice for my younger self is I would have done it sooner. I would have not waited. I was 41 before I graduated from nursing school and had all of my family. Although I know that my time is here and now and has been amazing, I wish I would have done it sooner. Something I've learned as a nurse, and this is post-COVID, is that nursing is hard, but it's just that one patient or that one family that just gets you through it, that you get that just goes on and lives, or that one touching family. The rewards come in little pieces here and there, and it just keeps you going.
Please give a warm welcome to Tammy Lawyer, registered nurse with Lakeview Hospital.
Wow, I got teary-eyed too. I'm a little awkward in the spotlight, so I didn't write a speech because that would require my glasses, and I don't like putting them on. So. But I'm truly honored, really, honestly. I have the best job in the world, and I work with the best team in the world. I couldn't be the nurse that I am if it wasn't for the team that I work with. The Lakeview Hospital ICU team, we are small but mighty. The best team in the whole world with the best director, Jackie Kennedy. COVID was hard. COVID was really rough, and it was hard on all of us. And I couldn't have showed up every day if it wasn't for the team that I worked with and the incredible skills that that my team has and represent every single day and showed up. And geez, now I'm just going blank. But I'm truly honored. I've only been a nurse for almost 12 years now, which is kind of a short time, I believe, but this came out of the blue, and I just truly am honored and grateful for all the opportunities and all the doors that have been opened for me since graduating nursing school. So thank you, Utah Business. I truly appreciate the recognition and the honor, and thank you to Lakeview Hospital and their administration is top-notch. They care about their patients, and they take care of their employees. And thank you very much.
We will now recognize our honorees that have implemented educational opportunities to promote expertise in the medical industry. Please take a look at the video screens to learn more about the honorees in our Healthcare Educator category.
For me, it was kind of a weird journey where a friend suggested it. They were like, have you ever thought about pharmacy? And I was like, no. So I went and shadowed a pharmacist, saw the relationships they built with the community and the people they worked with. And I thought, this is a place where I can put together my knowledge of science, my interest of science, with my desire to service and to help people. I am so fortunate in education that I get to work with the future of healthcare. I get to see students from their genesis and their early stages all the way through graduation, and now many of my alumni are my pharmacists that I go to, and I love that. Something I'm really focused on with my students right now, trying to really impress upon them, is the spirit of kindness. As healthcare practitioners, we may disagree with things that our patients do. They may not always listen to us all the time, but I want my students to go in with the heart of kindness and understanding so that we can work together to serve our patients. So I'm trying to get my students to understand how to remove biases from the things that they do, how to remove prejudice, and just see the person across them as their patient they're here to take care of no matter what.
Welcome to the stage the Assistant Dean for Admissions and Associate Professor of Pharmacy Practice for Roseman University of Health Sciences, Dustin Christensen Grant.
So really quick, I forgot that I was Southern until I heard that, and I was like, oh yeah, I still have an accent. So I want to start off with a story. Hopefully we'll cross our fingers that there's a point. I started out in North Carolina as a kid growing up on a hog farm, tobacco farm, didn't know what I wanted to do, and I had a friend in pharmacy school was talking to me one day, and she's like, you know, after you graduate, I think you're going to move to Utah. She lived in Draper. That's where she went and grew up in high school, and she made her way to North Carolina to do pharmacy school with me. And I remember actively thinking, I was like, moving to Utah, there is no chance that's going to happen. And it was really funny for me that I ended up here after my residency, but what I've learned through being here is the power of our healthcare community, and I really have grown to love it. As I've worked here in healthcare as a practicing pharmacist, I've learned how valuable and how fun it's been to work with physicians, social workers, case managers, nurses, and how they have elevated healthcare working together. And this is something I really try to impress upon my students. I was like, no matter how great of a pharmacist you think you are, working together is the future to elevate what we can do for our patients. So I really dedicate this award to all of us that have that mindset that the future is togetherness in treating the patient. It will always be elevated when we're together. So dedicate that to you. And I'd like to thank Roseman for being an excellent company to work for. I've loved my time here, being here since 2014. I'd also love to dedicate this to my husband, who is fantastic at telling me to go, go, go for my dreams, and is equally great at telling me to slow, slow, slow when I need to get home and do a little self-care. So thank you, everyone. I appreciate it.
I learned this the first day that I was in nursing school when we went to the university hospital and we worked with patients. And I had no experience working with patients. And I was so in awe that, and I was humbled that the patients saw me, a first day nursing student, as someone that they could trust. And so throughout my nursing career, I have always kept that in mind, that people trust me with the most vulnerable parts of their lives and with very intimate details about their lives. And I hope that I never take that for granted. And it's such an honor to have that trust. A lot of nursing students don't realize that unless they're going into pediatrics, they're going to be working with older adults. And they often think that they don't need to take gerontology classes, they don't need to know about the special healthcare needs of older adults. And so a real passion of mine has always been to work with nursing students, and now I work with students from across the health professions to educate them about how to best care for older adults, to provide age-friendly care and allow older adults to choose what matters most for them and how healthcare can help them achieve that.
Please give a warm welcome to Linda Edelman, Professor and Director of the Utah Geriatric Education Consortium with the University of Utah College of Nursing.
I have to say it is so humbled to be here and to hear the other honorees' stories about what led them to being here on this day. So I think it's a real honor and it's very humbling to be named a healthcare hero. I grew up in rural Kansas, and I have always had a passion for rural healthcare. And after I became a nurse, I worked in the burn unit at the University of Utah Health, and I saw older adults from rural communities come into the burn unit with injuries that were survivable, but yet because of where they lived, it was hard for them to receive the care that they needed once they were discharged from the burn unit. So that led to my academic career, and I have been so fortunate to work with a team not only of nurses, but of geriatricians, of pharmacists, social workers, gerontologists, to be able to work to provide age-friendly care, not only in hospitals, we're doing that at the University of Utah Health, but also in long-term care facilities. and particularly paying attention to the needs of older adults from rural communities. So I feel very humbled to take this award because really everything I do is because of a great team. And I want to acknowledge that together we can do really great things, greater things than any of us could ever do just as ourselves. So in closing, I want to thank Healthcare Heroes for this honor. It truly is an honor. Congratulations to all the other honorees, and then thank you. Thank you to my husband, Scott, who's here with me today, who also puts up with a lot of long hours and weird work schedules, but also to my team. I couldn't have done anything with any of this without them. And then finally to the University of Utah Health. They have given me employment and education and a real satisfaction and a job well done for many years. Thank you so much.
What inspired me to get into the healthcare at first was really a very personal experience with my mom, getting quite ill when I was very young, and I ended up being one of the primary caretakers for Mom for several years. When time came to decide what it is that I want to do with my life, I absolutely saw no other way, no other path but going into the healthcare and helping other people. The one thing that I wish all of our learners would learn from me is the fact that I think realizing your own power, realizing how much you can affect things that you don't even realize you could possibly touch, and continue pushing forward and pushing forward resiliently. It never came to me easy, and my career path has been full of all sorts of obstacles. However, if you hunker down and resiliently push forward, you will get there, and you will change healthcare. You will change the world.
Please give a warm welcome to Mikkel Schneider, Chief Executive Officer with Nightingale College.
Hi, thank you everybody. Thank you Utah Business. Thank you Roseman University for this honor and recognition. Congratulations to all of the honorees today. It's absolutely humbling and awesome to see such incredible passion in this room for what we do. I, have to send thanks to my mom and dad. They're right there. The inspiration behind my entire career, my mom, and also thank them for their courage in their mid-40s to uprooting and leaving our homeland, coming here to the United States as refugees, and then building a new life here. So thank you both. Also, my husband Jim is there. We've been together in a couple of weeks here, 23 years, and so thank you for all of your support throughout. And finally, there are other folks at that table, just several of my collaborators at Nightingale College, who set out, a little over a decade ago, we set out to reimagine education for nurses, just completely take a stick of dynamite to what exists to make sure that we can bring this education to anyone who wants it, anywhere in this country, certainly in the state, but we started here in Utah and then expanded now with several thousand of pre-licensure nursing learners across this country. I think we're making a difference in communities. The Future of Nursing report that was published last year, this is the second report from the National Academies of Medicine, just simply said this: we will never achieve health equity in this nation until the profession of nursing is educate, the systems that educate, that employ, that compensate, and nurses change in this country. And most importantly, bringing diversity to this profession is really, really on top of that list. So closing education, those of you who are educators in this room, closing education equity gaps is so, so important. And I'm glad, we talked about at Roseman and learned about what they do and the diversity of your students. That is incredible. So let's all continue doing that. Let's bring enough practitioners into the world so we all can be taken care of when we need it. So thank you so much. I appreciate this and love to all. Thank you.
The intent of the international clinical programs is to immerse students, provide them with opportunities to travel to diverse and underserved areas. So, for example, we take students to Guatemala as well as Roatan, Honduras, and they work with our partner organizations there to help serve the populations and communities they work with. And while there, students are able to experience very different communities. They'll struggle a little bit with the language, of course, but interact with people who are very different, who have lived very different lives than them and have different struggles than what individuals here experience. And so it's very important and meaningful for them to have that exposure, because these students hopefully will continue working with and serving underserved and disadvantaged populations in the future. The things that I hope students really take away from participating in these programs is how to be engaged, how to be accountable, how to be inclusive, and how to be kind. If they take those 4 things with them and carry that with them through the rest of their lives, they'll go very far.
Unfortunately, Daniel is currently in Honduras working with students and could not be with us today. Accepting the award on his behalf from Joyce University of Nursing and Health Sciences, please welcome Hafsa Abdi Kadir.
I'm usually not a public speech person, but I've known Dan. We went to nursing school that was 14 years ago, and when he reached out to me and said, hey, do you mind just doing this for me? I couldn't say no to that. My name is Hafsa Abdelkader, and I'm accepting this speech award on Daniel's behalf. He is currently in Honduras working with a team of nursing students. I think he sent some photos to share with you guys. Daniel would like to thank the faculty, staff, and administration at Joyce University who have supported and put effort into the international clinical program, which started just 1 year ago. By the end of this year, 89 nursing students will have participated in an international experience, which is incredible for such a new program. The nursing students gain invaluable practical experience that prepares them to serve resource-limited and diverse communities, navigate language and communication barriers, problem solve as a team, and be an advantage for those who are sometimes forgotten. These are translatable skills that will help them be robust leaders in any setting that may work with, and we hope upon graduating that they will continue to develop these skills to improve the health of disadvantaged and underserved population wherever they are. He would like to also express gratitude to our partners, I Am Hope Guatemala and Clinical Esperanza in Honduras, who work hard to include us in the care of the communities and inspire us to do more with what privileged resources we have. Finally, thank you, Utah Business. It is an honor to be recognized today and humbling to be in the company of so many inspiring individuals. Thank you.
Let's give them another round of applause. Now we will find out a little bit more about our honorees in the next category, innovation. These honorees have shown immense compassion and have developed programs that have delivered the best possible care and support for patients and their families. Please turn your attention to the video screens.
When I was out of school, I was a finance major and degree and thought, you know, that's not very inspiring. How can I take that and translate it into something that has an impact on people's lives? And healthcare really fit that. So no matter where you work across the healthcare continuum, whether you're a frontline nurse or you're a security guard or someone who works in finance, your ability to make sure that people are cared for and supported at those most vulnerable times is really meaningful, and that what inspires me every day. As a single individual, the impact that I can have is going to be pretty limited. If I'm able to bring together teams of people and groups of people together, that impact is simply going to be multiplied. So I always measure success in terms of how well are the people around me doing, how well am I as a leader empowering them, for them to achieve success and fulfill what their goals and ambitions are. Healthcare today is really complex. We know that it's very expensive. We know it can be scary. And so when we develop and deploy strategies that make it less confusing, make it less scary, make it so that people don't have to worry about how they're going to pay for critical care that they need, that's really rewarding to be able to see improvement across all of those different elements of people's lives.
Please welcome to the stage Vice President of Strategy with Intermountain Healthcare, Dave Dirks.
So I moved to Utah in 1996 with what I thought would be a really brief stint, as I mentioned, get my finance degree and then move on to New York or Chicago and work in the world of high finance. I was lucky enough that during school I got a job at McCady Hospital in Ogden and met and fell in love with my wife there, and also fell in love with the work that we get to do in healthcare. What kept me at Intermountain for 22 plus years now is the organization's unwavering commitment to innovating towards our mission of helping people live the healthiest lives possible. What has kept me in Utah is a firm belief that the solutions that are going to help solve the healthcare issues we have in this country and in the world are going to come out of Utah. And all of the honorees that we're hearing from today, I think, are all of the evidence that we need for that. Would like to thank Utah Business for recognizing every year the folks that are innovating and are leading the way in terms of solving what are very real needs in all of our communities. I want to thank a number of mentors and leaders at Intermountain that have been invaluable into helping improve health, a couple of which you'll hear from here in a minute, and Dan and Heather. And want to thank my incredibly supportive family and all of the caregivers throughout Intermountain Healthcare that just show amazing commitment and a willingness to go along in the journey of already having a very difficult day job and caring for people, and at the same time being willing to step up and find new and innovative approaches. So thank you very much. Appreciate it.
Well, the most rewarding thing that I do is get to work with wonderful people at Roseman, our faculty, our staff, our students, and I get to do that every day, and I get to be real creative in the projects that we get, and I get to see the creativity and allow them to reach their full potential at Roseman. Being part of education allows us to reach more patients, and we can have influence on the lives of young practitioners and influence them as they go into practice. And that really is a great thing for us in education to be able to do. And that's why most people find so much satisfaction as an educator. I hope that my students learn from me the ability to give back and serve the community. And we have many events and many projects, And the most important thing that we do to get out of those projects is to remember that it's most important that we serve those that need the help the most and to give back to those that are less fortunate than we are.
Give a warm welcome to the Dean of Roseman University College of Dental Medicine, Frank Licari.
Well, good afternoon. And yes, I can't see any of you while you're up here. I'd like to thank the selection committee at Utah Business for this honor, and our university president, Dr. Renee Kaufman, and our campus chancellor, Jeremy Wells, and the board of trustees for their unwavering support. But while I'm up here accepting this award today, it is the absolutely outstanding faculty and staff members that we have at Roseman's College of Dental Medicine that are the true healthcare heroes. They work tirelessly every day to make our vision of a new educational and clinical care model become a reality. I thank all of them for the privilege that I have to be their dean and lifelong colleague. I want to congratulate my fellow recipients for the exceptional example you provide of selfless service to others, and I thank everyone here for your kindness and support. Thank you.
Something unexpected I've learned from healthcare is just how systemic the problems are, and every health system is dealing with similar problems. And what I found is a new willingness perhaps for health systems to partner together to solve big issues. And we learned that through the COVID-19 pandemic and through some of the initiatives around creating a nonprofit drug company. It's been really fun to identify commonalities among health systems that traditionally compete one against another. So one innovation we're working on at Intermountain Healthcare in partnership with 55 other health systems and 23 national payers or health insurance companies is a project to democratize insulin. So through a company called CivicRx, which Intermountain Health formed, which I serve as the board chair, we're working on bringing 3 insulin molecules to the market in 2024, where we hope to reduce the price of insulin by up to 90%. I find working in the innovation realm of healthcare totally fascinating. There's an opportunity, there's traditionally been a misalignment of healthcare incentives where healthcare systems have been paid to treat people, and what we're trying to do at Intermountain Healthcare is really move upstream, keep people well. And that is helping us rethink everything we do from top to bottom, and it's a really exciting time to be in the healthcare industry.
Congratulations and welcome to the stage, Dan Lillenquist, Senior Vice President and Chief Strategy Officer with Intermountain Healthcare.
Thank you. I've spent the last hour trying to remember what I said in that video. I know all of you are feeling the same way. It's been a little while since we've done that. I found healthcare a little bit later in my life. At 38, after unsuccessfully running for the U.S. Senate and getting absolutely destroyed by Senator Hatch, I didn't know what to do with my life, and I had a friend say, I think you would like Intermountain. And he was right, and I am profoundly grateful that I lost that race because I don't think there is a better cause to invest your life in than trying to make a difference for other people. And I feel that from all of the honorees in the room today, and just know that I love and admire you for that. I'm excited what we're doing with Civic. I'll tell you, when Dave got up here, Dave and I shared an office for 2 years, and we have totally different personalities. And he didn't like it at first, and neither did I. But in that room, we kicked around an idea of how we could maybe make a difference with respect to affordable drugs in this country. And this little idea of Civic RX came out of that office at the World Trade Center in downtown Salt Lake City. And fast forward 6 years later, Civic has treated 40 million patients and has 65 drugs on the market. And what I've been amazed by is this amazing mosaic of people all over the country who've come together to help us do something meaningful for people. And there are a lot of forces that are stacked up against people who can't afford their own health care. And I grew up with 3 brothers with type 1 diabetes. That's a hard enough disease to manage and live with every day, let alone worry about how you're going to treat yourself and afford to treat yourself. So it's been the honor of my life to be involved in something like this. And I'm grateful for the recognition in the sense that it recognizes literally hundreds and hundreds of people who helped us make Civic a reality, and the tens of thousands of people I get to work with every day, not only at Intermountain Healthcare, but in this community to try to help people live the healthiest lives possible and do what's right for people. Thank you to Utah Business. Congratulations to all of you. It's an honor to be associated with all of you. Thank you.
With every hospital, clinic, institute, or laboratory, there are always those that are leading the way. Let's meet our administrative excellence healthcare heroes. Please turn your attention to the video screens.
I got into healthcare while I was in college. I processed claims at Blue Cross Blue Shield in Medicare, and I realized there was such a wide array of jobs available in healthcare, and it's really opened the door to me for a number of career opportunities, and I would recommend a career in healthcare to anyone. One of the things I've learned about doing HR for a healthcare company is most people actually think of healthcare as physicians and nurses, and we have tons of them in our organization, but we have so many other jobs that touch every kind of profession, everything from accountants to IT, HR, architects, real estate agents. So I always tell high school and college students, healthcare is a really great place to start and many doors of opportunity because we have just about one of everything in healthcare. Myself, I started as an entry-level employee at Intermountain Healthcare, and today I'm the top position for HR. And I always say to people, everybody has that ability, kind of potential in the organization. So I love seeing people go from housekeepers to nurses, from orderlies to finance directors, and just that growth potential inside of the organization as people find their way along their career.
Please welcome Heather Brace, Chief People Officer with Intermountain Healthcare.
Thank you. As Dan thought about what he said the last hour, I actually thought I probably should have written something down. But I want to say thank you to Utah Business and to Roseman University, more than anything for just recognizing people who work in healthcare. It's been a really hard last 2.5 years. And when I think about the practitioners and the nurses that got recognized today, we probably could have a room full of nurses and doctors that could be recognized. But I feel really honored. I would never consider myself a hero. It's really hard for me to see that on the screen. But I'm privileged to represent 59,000 heroes at Intermountain Healthcare. And I am passionate about people because I started, neither of my parents had a high school education. I moved to Utah 25 years ago, started working at Intermountain 23 years ago. Every opportunity I've had to grow and learn and thrive and be an amazing leader has been given to me by Intermountain. And my role and my team's role is to think every single day how we can make Intermountain Healthcare the best place to work and a place of opportunity. So I feel really honored and privileged to be among each of you in this room. And I probably would be remiss to not say If you or someone in this room is looking for a job, we have 5,000 of them open. So thank you very much. And I want to say thank you to my husband, to Intermountain Healthcare, to the team that supports me every single day. And I feel privileged to be here with Dan and Dave and Sebastian, and we have many more leaders like them at Intermountain. Thank you.
When I was young, I wanted to be a fireman or a policeman. I think that's a pretty common job description for a young boy. But as I look back on that now, I realize what I wanted to do was serve others and have the opportunity to make a meaningful difference in people's lives. What I love about our industry is it's dynamic and it's changing and it's different every day. Especially over the past 2.5 years, it's been a dynamic, changing environment, and I love the fast-paced environment, but I love the opportunity to organize systems and people in a way that delivers exceptional healthcare. The real heroes in advanced healthcare are our frontline caregivers. Over the past 2.5 years, we have battled through what we will look back on as being the most difficult environment of our careers. And our frontline healthcare professionals have been innovative and creative and dedicated and have risen to the occasion and have provided much needed healthcare services in a trying environment. And these individuals are the real heroes of advanced healthcare.
Please give a warm welcome to the President of Advanced Healthcare, Andy Frazier.
I saw that Heather got makeup before her video. I didn't have any options on makeup or anything like that, but I'm appreciative, and I echo what all the honorees have said, echo appreciation to Utah business and to all of the healthcare heroes in our industry. I meant what I said in the video. The last 2.5 years have been difficult for all of us, incredibly difficult and challenging, but even more so for those frontline workers, for those nurses and practitioners and therapists and housekeeping personnel, and the frontline people have shown diligence and have accomplished great things, and we recognize them, and we salute all of you in this room that are among those that have been on the front lines during this incredibly challenging time. Advanced Healthcare, we are part of the Larry H. Miller organization, and our mission is to enrich lives by providing exceptional patient experiences and exceptional outcomes. And as we focus on those things, we're able to accomplish great results individually, case by case, patient by patient, and that's the great thing about healthcare, is that opportunity to help others and to be there when people need us. I'm appreciative of my team that have nominated me, and on behalf of all the thousands of exceptional employees in advanced healthcare, say thank you to all the other healthcare providers that do an exceptional job day in and day out, caring for those in their most vulnerable times of their lives. Thank you.
I wasn't always sure that I wanted to be in healthcare. I actually thought I wanted to be a scientist. And then I learned that in the field of medicine, there's something called pathology. And pathology is the study of the disease, and it's all about diagnostic testing, using a microscope, looking at slides, understanding lab tests, and it's very scientifically motivated. And I realized that I could become a physician, but also be a scientist by being a pathologist and studying laboratory medicine. The work I'm doing is changing the world one patient at a time. I'm also involved in clinical trials research for rare diseases, and I'm proud to say that we've helped bring on several new precision medicine drugs for rare treatments. Now patients can live longer and healthier lives because of the work that we've done. Pathologists are often under the radar, and that's okay with me. We know that we're doing good work, and our whole company is based on that. We believe in patient care. We believe in the quality of the work that we do. Every day we make a difference in patients' lives.
Congratulations and welcome to the stage, Dr. Tracy George, President and Chief Scientific Officer with ARUP Laboratories.
So 70% of the data that informs your healthcare decisions comes from the clinical laboratory. And I would have said before COVID that we were the lab, the unsung heroes of the healthcare system. But now I think every single one of you appreciates what quality laboratory testing is. We all know that quality testing is what informs your healthcare decisions. And at ARUP, we're one of the nation's largest reference laboratories, and it's all about patient care and quality laboratory medicine. I work with incredible people who work so hard. And during the COVID pandemic, people really stepped up, right? Saliva testing, new ways of doing COVID testing, helping healthcare systems set up their COVID labs, including some healthcare systems that are actually in this room today. And we did it happily and we did it well because we know this affects millions of patients, all of the laboratory testing that we do. And I'm really proud to be president and CSO now at ARUP because everyone on our team shares this vision. All of the pathologists, the clinical laboratory scientists, the technicians in the lab. We've got almost 5,000 people here in Salt Lake City, and we serve all 50 states, most of the academic healthcare systems in the nation, the children's hospitals, and community healthcare systems. It's all served by ARUP. So I want to thank Utah Business and Roseman University, and most of all my colleagues at ARUP for having confidence in me. Thank you, and my husband.
Our final category for the day will recognize our Lifetime Achievement honorees. If you would please direct your attention to the video screens.
I really love Lakeview Hospital. I like the people, and I like the patients, you know. It was really important for me to keeping the patient happy, you know. When I see the patient is really sick, you know, later the next day I come back, you know, and the patient feels so really good, you know, and I feel so happy to see these people. And I sing a music for them, you know. Give me sunshine, don't put my sunshine away. Make my patient feel better. I say I pray for you to feel a lot better soon, you know. Happy birthday to you, happy birthday to you. Happy birthday, dear patient, happy birthday to you. Cha-cha-cha.
Please give a warm welcome to Egda Minnick, Environmental Services Associate with Lakeview Hospital. She is not here with us today, but on behalf of all of us at Utah Business, we thank her for her service.
One of the things that inspired me to start Eye Care for Kids is I'm a board certified optician and I had a practice called the Eye Doctor for many years. and we saw many children without being able to afford professional eye care. So my wife and I started Eye Care for Kids. We're a nonprofit, and we're 21 years old, and we've helped 400,000 children get professional eye care. What we do day to day at Eye Care for Kids is we perform vision screenings, eye examinations, and we give cool eyeglasses to children who are underserved or don't have the resources to get professional eye care. The most rewarding thing that I see every day is the smiles on children's faces when they get their new cool glasses and they can see. We had one child actually get their glasses and they looked out the window and they began to cry and laugh at the same time. And they said, "I didn't know trees had leaves." If a child can't see, they're not going to read, they're not going to learn. So having the correct eyeglasses is really important.
Please welcome to the stage our final honoree of the afternoon, Joseph Carbone, founder and president of Eye Care for Kids.
So these things really make me nervous. I leaned over to my wife, Jan, and I said, "Will you come up with me and hold my hand?" She gave me that look. So since I didn't want to spend the night here, I'm here by myself. And Dan, you may not remember it, but even though I love Senator Hatch, I campaigned for you. So this is amazing, so thank you so much. Obviously, to help 400,000 individuals and to have provided almost $200 million of vision services to underprivileged people, it takes an army. So I am the least of that army. So I stand here with all of those who are of that Eye Care for Kids army and say thank you. We gave you a gift, and so at the end of this you can look at the gift, and it's a pair of really cool sunglasses. So when you put those glasses on, or those who are wearing glasses, next time you put your glasses on, think about the 500 million children worldwide who don't have access to vision care. Together, we will sight the world. Thank you.
Thank you so much for joining us in honoring some amazing healthcare heroes. As someone not in healthcare, I will say that the work you're doing is so important. I do stories every night on stories in the community of people suffering from lack of healthcare or COVID, or the impact of COVID-19 on nurses and the healthcare community. And I just want to give a very huge thank you from just the average Joe out there on all of the work that you guys are doing in your industry. I do have a few housekeeping items to let you know about. So you may have noticed the QR code in the middle of your table. As an attendee today, Utah Business would like to offer you a complimentary year subscription to their monthly publication. Feel free to scan the code and complete the registration. As a reminder, parking is paid for, so the gate will actually be open as you leave. So if you didn't get a validation, no worries, parking is already paid for. We do like to recycle our name badges, so please feel free to leave them at the table or drop them off at the registration desk. Thanks again for coming, and congratulations to the 2022 Healthcare Heroes.